How would you describe kind of what health anxiety is to the lay consumer, to the person buying the book?
I would say that, usually it presents in one of three different ways for people. The first time is the times where we might actually have a medical diagnosis. I've met with people that have had cancer or maybe is in remission from cancer. So they've actually had a medical issue that has been going on and they feel very anxious about it.
Yeah.
They have a lot of anticipation, worry about it, those types of things.
This book is also mostly written for people who have physical symptoms that have not been found to be medical. And your concern is that there's something much more serious than what doctors, medical providers have actually said. So the common examples, Michael, usually are someone has a headache and they think maybe it's a brain tumor. Someone has recurring diarrhea or stomach aches. They think there's something more serious with their gastrointestinal system than just tummy aches. Someone has an occasional sore that they think maybe is a much more serious issue like leukemia or bone cancer. So again, when you have genuine physical symptoms, but the medical institutions have ruled out and done all the tests and have deemed you to be medically healthy even though you're physically not doing well. That's category 2.
And then the third category, we could put those things into, well, then what if there's no symptoms present? But sometimes it's just a scary idea that what if I have cancer and they just have not found it?
And the titles, diagnoses, and names have changed over the years. But basically, those three categories define health anxiety. The first one, I think, is a little more controversy around when you actually have a medical issue and you're worried about it, which most people would. The second category is when you have physical symptoms and there's nothing medical wrong with you that the medical institutions have been able to prove. You've gotten a clean bill of health, full workup, and they see nothing, but you're still concerned. And that third category is when you have no physical symptoms or medical symptoms, yet you're still really worried and preoccupied with, but what if I get blank disease? So
one of the things that we try to make sure that we talk about with people is that regardless of where the symptoms are from, they're all real.
Yes.
But they just may not be what they think that they mean. And I think that's a really important kind of thing that you can learn through our book is that, all these symptoms are totally real experiences that you're having. And we want to validate that for all of you guys too. At the same time, it just may not always mean what we think that they mean.